Meanwhile, the World Health Organization tonight took time to respond to the current debate on vaccines in South Africa, their safety and efficacy following the Chief Justice's statement on vaccines.
I fully agree with what my colleagues said, that especially with regard to some wrong perceptions of the vaccine, it's not just in Africa, but it's all over the world. Then when we come to the testing, especially the vaccines for COVID have been tested actually outside Africa more than in Africa. Having the testing, as long as the right protocols are followed, it's very important, and that's what has been done. And the testing, I don't think, has been focused in Africa. Actually, it's more outside. But the most important thing is whether it has followed the right protocols or not. It's whether it's done in Africa or other places, but it's done in many places. Then, when vaccines are introduced, whether they get the emergency use list or finally pre-qualifications, the safety is central in addition to efficacy. So we follow that, and other organizations, regulatory bodies also follow that, and we will make sure that whatever vaccine is available, the two important criteria are met: the safety first, and then of course the efficacy. And then the issue you raised with religion, I remember when HIV reached its climax and some medicine started to appear, and some people were saying, either you follow your religion or you follow the medicine, the two can't go together. But, religion and science can go together. And I remember during that time, religious leaders themselves come out and told the public that taking the medicine and doing their religious practices actually doesn't contradict. And many accepted that, and many took medicines, and they saved their lives. So for our religious leaders, it's very important to see from the right authorities whether the right safety and efficacy measures based on those the medicine is or the vaccine is being provided or not. That's what they should focus on. Actually, I would like to use this opportunity. It's the role of leaders, religious leaders, community leaders, political leaders, to be models and examples to convince their followers to do the right thing. And I hope our religious leaders will do their best to fight the pandemics, to fight the virus, using the tools we have at hand, and when vaccines are provided, to also help their followers to benefit from the vaccines. I thank you. Thank you, Sophie.
The World Health Organization says that nearly 1 billion doses of leading COVID-19 vaccine candidates have been secured as part of a program to provide treatment for low and middle-income countries. The WHO says that nearly 190 countries are participating in the COVAX program. Well, for more on the vaccine challenges facing Africa, we're now joined via Skype from Zimbabwe by Lois Chingandu, who's the Director, Evidence and Influence at Frontline Aids. Lois has also been closely involved in the People's Vaccine Initiative. Thanks so much indeed for joining us, and welcome to the program.
Thank you. How are you, Peter?
No, we're doing well, and we are hopeful that as we hear stories of vaccines going from trial to being given emergency status, that we in Africa will get our fair share of those vaccines as they come out. And I guess that this is something that you're watching as well.
Yes, this is something that we've been watching very closely from the time that a number of vaccines started showing real promises. But to our surprise, we were very surprised when we saw that the rich countries started making deals even before the vaccine was found. They each made deals with the pharmaceutical companies to buy almost all the doses that are being produced. And at that point, we realized that there was need for us as activists to come out very strongly and speak very strongly against this, because it immediately contravenes the whole idea of global solidarity when we start encouraging such inequality just because other countries can't afford it. Just to put it into perspective, even as we speak today, we anticipate that 9 out of 10 people in some of the world's poorest countries are not going to be able to access the vaccine next year unless something changes, because 14% of the world population lives in the privileged countries. And yet they have purchased 53% of the vaccines even before they become available on the market. So this is really an issue that concerns us.
What about initiatives like the COVAX program? Isn't that going to help African countries, or is it just not enough?
So when COVAX was set up, the whole idea was to have one platform through which the demand for vaccines would be determined, and then the vaccines could be purchased through that COVID mechanism. However, to our surprise, this was initially not supported by the rich countries as they were going out to negotiate the deals. So for a while, it looked like COVAX was not going to be as successful as we anticipated it to be. Even as we speak, the target was COVID should purchase at least 2 billion of the vaccine doses. As you heard from WHO, they've only purchased 1 billion, and that's because they didn't get as much support as they expected from the rich countries.
All right, and somebody who works on the front line of AIDS and HIV, you understand the resources and lack of resources on the continent, and so that we even have another challenge that even if those vaccines arrived, we probably are not ready to receive and distribute timeously.
You know, while that is to some extent true, I'm also aware that a lot of countries, even including through the African Union, they have already started preparing for receiving the vaccines. There has been talk around the issue of temperature. You know, the vaccines need to be kept at a certain temperature. This should not be a deterrent or a barrier to vaccines coming to Africa, because if anything, Africa has the one of the highest records of distributing just child immunization vaccines, which also have to be distributed at a certain temperature. We still encourage countries to continue to prepare, because preparation is important, particularly preparing the communities so that we don't have the situation that I listened to earlier, where we do have sectors that are discouraging people from taking the vaccine once it is here. So countries have a responsibility to do that community literacy work on the ground. While some of us who sit at the global level, we really have a responsibility of ensuring that the vaccine comes to Africa and it comes at free cost, because we believe it was developed through taxpayers' money.
All
the
right.
researches were done through taxpayers' money, yeah.
All right. COVID-19 has been quite disruptive on many fronts, and somebody who deals with HIV and AIDS and treatment, it has been a problem as well for HIV treatment, hasn't it, in terms of getting to drugs and getting them out to the people that need them? Yes,
because if you remember, as soon as COVID clearly became a challenge. Most countries' response was a total lockdown. And the lockdowns, when they happened, there wasn't enough time for people to get long-term supplies of antiretrovirals. So many people were caught off guard without their treatment, and they defaulted for a while. It has taken a lot of civil society organizations now working together with governments to making efforts to take these drugs to the people on the ground. And so we are quite happy because in many countries, governments opened up now to give 3 months supplies, 6 months supplies where they are available. So that in a way has helped us. And this is the reason why we are really pushing for the COVID vaccine, because long term, if this situation stays, as you see, many countries are now going into a resurgence or in a phase 2. If we go back into lockdowns again, we will have serious problems. So it's so important that we get to the vaccine out to everyone, everywhere, as soon as possible. Talking about HIV, we are seeing a lot of similarities between what happened with HIV treatment and what is likely to happen with the COVID vaccine if we all don't talk about it. When the HIV treatment was found in the rich countries, people went on treatment and started living almost normal lives, while in Africa, people were still dying because there was still, discussions of whether can Africans take antiretrovirals or not, and where they were available, the prices were, out of this world and out of the reach of the poor. And it took years and millions of people dying before the actual treatments got here. So we cannot allow that history to repeat itself with COVID.
All right, and I suppose the vaccine also critically important in Africa, because there's so many people who perhaps are HIV positive but don't know it, and their immune system is compromised and vulnerable to COVID-19.
Exactly. And, generally in Africa, people report for treatment very, very late when their CD4s are very, very low and they are already in the AIDS stage and very immunocompromised. And with the large numbers of people we have who don't know their status, and even those who know their status, we still have people that know they are HIV positive who are not on treatment as we speak. And so the need for a COVID vaccine is beyond the need. We need it, and we need it now.
All right. What more can we do other than just talk about it?
We have been, on our part, we've been doing quite a lot in terms of lobbying. We have been lobbying everywhere, including the chief executive officers, of these big pharmaceutical companies. And I encourage that everybody needs to continue to talk about this at every opportunity. We know that change will happen. They will listen. They have no choice. They have to listen. And the more voices, the better. We have even produced videos from survivors of COVID who are appealing and calling for sensitivity and equality in the distribution of the vaccine. So my call is that, every media, everyone who has an opportunity to speak needs to talk about this. I want to really comment South Africa and other countries. I know that yesterday they addressed the TRIPS conference that is happening right now, and they did speak passionately. They even called this. If we don't have a global vaccine for everybody, then we are practicing vaccine apartheid, which I thought was very profound.
All right. Yeah. Well, that's where we'll leave it. Thank you so much indeed for joining us. And I think, as you say, we must have more of these conversations and make sure that this stays on the table. Thanks so much indeed for sharing your thoughts with us tonight.
Thank you, Peter, for inviting me.
Tatenda shukuru. That's Lois Chingandu, who's the Director, Evidence and Influence at Frontline Aids, speaking to us about the challenges that the continent is facing in terms of making sure that we get our fair share of that vaccine when it comes through.